Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, authorities beefing up measures to prevent the Wuhan coronavirus spread.
Handa naman po ang ating gobyerno magpadala ng eroplano kung sakasakali, sunduin sila doon sa China.
The Health Department warns against fake information amid outbreak concerns.
Who confirmed it? Unless you give me an answer, I'll say there is no basis.
But assures the public that the country is ready to deal with the deadly virus.
I wish to inform our kababayans that the government will take care of you whether you choose to stay or return home.
Iloilo Representative Janette Garin and ang Probinsyano Partylist Representative Ronnie Ong join us live. Thank you for joining us. I'm Pinky Webb. The government has created an interagency task force to deal with the Wuhan coronavirus outbreak should the dreaded virus make its way to the country. The Health Department says they are monitoring a number of suspected cases, but they also appeal to the public to stop spreading false information on the virus. Also, the Immigration Bureau temporarily suspends the issuance of visa upon arrival, or VUA, for Chinese nationals. But what else can be done to prevent the spread of the novel coronavirus? Let's go straight to the source of the story first. We have Iloilo Representative and former Health Secretary Janette Garin. Congresswoman, thank you for being here. Welcome to the show. Okay, so still no confirmed case. Just to be clear, still no confirmed case of the...
Based on DOH reports, I believe that. Okay. But if I may continue, because I've been appealing since the past days. I've been appealing since last week that all fake news should be stopped because it's not helping.
Yeah.
Further, the hospitals where patients are being observed should not be announced because it deviates the attention of people from the real issue. It burdens the healthcare providers, and apparently there are just news sprouting everywhere. So what should be done is that the DOH, is what we have demanded yesterday and the other day, should come up with regular updates because they are in constant contact with the World Health Organization, who is at best to explain to us what's happening.
Which they are going to be doing every 1 p.m. That actually began yesterday.
Yes, yes. And an interagency coordination, because every time, this is not the first time this happened to the world. We had MERS-CoV, we had SARS, we had Ebola. And prior to that, in, let's say, the early 2000, in 2010, I think, dengue was also like this. Prior to that, in the 1990s, HIV was like this.
So it's nothing new.
It's nothing new, but again, as I mentioned before, every time there's a news like this, the department transforms into a swan. There's a graceful outside telling the public what the public should know, but not creating panic, but beneath, their feet are paddling. So they're on the go, preparing the whole country.
Is the health department doing a good job right now, you think?
Well, I leave it to the people to comment. Many people are doing their job. It's a matter of coordinating everything, because the first thing that should be done by the department is to call for a command conference. That's very basic. And then they update, of course, they inform the president that they're doing this thing and immediately loop in DepEd, the Department of Education, and the Department of Interior and Local Government. Because when that happens, like suspending schools right and left will not happen if the schools are aware and there is communication to them, telling them what is happening or what to expect.
Well, you bring that up, Congresswoman, because it was, I believe, Monday when certain schools in Manila suspended classes on their own. In fact, Secretary Duque was here and I told him that some schools suspended classes such as the Uno High School, Chiang Kai-shek, and he...
There were 10 schools.
Yeah, yun yung dalawang naunang nakita namin, ma'am. And eventually there were more, no, after that, maybe about 10. And in fact, he was not aware of that. Pero sinabi naman niya that he leaves it up to them. Maybe they know something, sabi niya, that I don't know. Yung ganun ho ba?
I mean, apologies for that. I do respect Secretary Duque, but that should not be the way. Kasi pag sinabi mong it's their decision, baka may alam sila na hindi natin alam, you are the authority on health. The office is the source of information for DepEd. And DepEd conveys it to its schools. Padali naman yan may cellphone eh.
So dapat nanggagaling, what you're saying is that, anything should emanate from the Department of Health.
Of
It should be
course.
the Department of Health that would say that to the schools, this is what's going on. Kaya sabi mo, kailangan may command conference.
Yeah, pag nangyari na sa China, di ba, merong nangyari, magre-report sila sa WHO, alam kagad ng lahat ng bansa yon. The Secretary of Health immediately informs the President and then calls for a command conference. Why? Para alam ng regional directors mo, alam ng chief of hospitals mo, and then you create a war room. There's actually a room in the department that is usually transformed, and there's a 24/7 director in charge of that. So every time parang may endorsement, may shifting yan. So what's happening is that they also loop in the other government agencies. You loop in all the regional directors, and the regional directors will start making representation with the League of Mayors, the League of Municipalities, and the governor. Kasi marami why is people thriving or believing in fake news? Because there is not an authority that is giving regular updates. But it's not too late.
Yeah.
All of this can be done. I believe DOH is also willing to coordinate with other government agencies. And
So you're a little disappointed that a command conference looping in the Department of Education and the DILG did not happen.
somehow yes, kasi tumatagal yung tao pagkatakot, dapat sabihan mo na hindi ka dapat matakot, pero ito ang mga preparasyon ng departamento. Of course, you don't give them 100% assurance. You don't downplay the situation. You give people the facts, and then you prepare. Nandiyan na yan eh. All you have to do is activate the system because many people in the department are already trained to do that. Many hospitals have been prepared. In fact, if you remember, the issue of negative pressure rooms was there before. And before I left the department, there were the upgrading of the Research Institute of the Biosafety Lab, yung laboratory ng RITM, was already in place it was already upgraded to Biosafety Level 3.
Ano po yun?
Ang ibig sabihin noon, yung kakayanan niya na mag-test ng mga ganitong sitwasyon. And this was actually a project in response to MERS-CoV and Ebola. So the question is, are we prepared? Infrastructure, capacity-wise, yes. But you have to activate the system.
Okay. And let me ask you this, though. We still have no confirmed case of the novel coronavirus. Are we lucky, or is it because the department is doing a good job?
I don't want to prejudge the department, no? Kasi maraming tao doon ang mga magagaling at ginagawa ang trabaho nila. But it's a matter of tapping them. Talking about the fact that we are lucky or not, maraming mga sakit ang napupunta sa atin because of our environment and because of the situation that we are a tropical country. But on the other hand, meron din mga sakit na nahihirapan silang mag-survive sa atin dahil masyadong mainit sa Pilipinas. So, we still don't know if this virus is related to temperature because it's winter in China. We know that the viruses can't survive extreme heat. But precise for me to say we are lucky because many scientists and many experts working all over the world are actually Filipinos.
All right, we'll be taking a short break. We'll be right back. You're watching The Source on CNN Philippines. Our guests today, Iloilo Representative Janette Garin, and joining us now, ang Probinsyano Partylist Representative Ronnie Ong. Congressman, good to see you. Welcome to the show. All right, let's talk about the fake news because let's talk about the news rather. Some fake, a lot of them actually, have been making the rounds on social media. Merong kaso dito sa Muntinlupa, may kaso dito sa Asia, may kaso dito sa Metropolitan Binondo. How should, let me just bring in this premise. I had Secretary Duque Monday at inisa-isa ko sa kanya yung mga lumalabas na balita para i-debunk niya. How should the Department of Health address these social media posts? Congressman Ong, let's start with you.
I think I'm in agreement with Congressman Garin. The command conference will greatly help kasi people will know that we are in control. We are here and information can be gathered from that. Ang nangyayari kasi problema ngayon, like what happened to the Chinese school, syempre things will go around na bakit pa sila nagsara? Why nag-suspend ng classes? Doon na nagka-start yun sa social media. Meron na from here, from there, and from that. Parang natatakot ang tao. And somehow, nakaka-disappoint. Kasi, of course, we all know this is hard to control. Pero sobrang ng daming news na going around na hindi na talaga alam ng tao kung ano talaga nangyayari.
So what should the department do? How do you solve that?
They have to have news conference every now and then to update the people on what's happening.
Pero hindi ba ang nangyayari naman, I think it started yesterday that every 1 p.m. They have a press conference. It began, I believe, yesterday. So, maliban doon, apart from that, after, let's say every day at 1 p.m., what else?
Let me comment on that. No, Unfortunately, when DOH was having press conferences, they were also mentioning some hospitals. And this should not be the case.
Yeah, you were saying we should not mention, the Department of Health should not mention the hospitals where there are suspected cases.
Well, what help will it do? It will create more panic than help the people. And you start discriminating the people, the patients, and the health workers from that hospital. So let's say I'm an employer, I'm a doctor in this government hospital that the DOH just announced. Ngayon, pag uwi ko, pupunta ako sa kung saan-saan, like people will say, oh, we can't go near you. How can you work if people starts discriminating you? And walang add-on yun
No basis.
Ever since hindi talaga sinasabing hospital, moving forward, the schools are confused, not only Chinese schools, but Filipino schools. Business establishments are confused. You would go to a restaurant, and you see all the staff in masks. Will that frighten you? Of course. Psychologically, it has an effect. You go to a hotel, everybody from the guard, from the x-ray, from the lobby, from the waiters, they're all in masks.
Yeah.
Because nobody is telling them what to do. Nobody is telling them that it's not
But are
actually
you
effective.
saying that's wrong? Is it wrong for us to wear the masks?
Okay, let me categorically say yes and no. If you are sick, it's good to wear a mask because you're protecting others. But if you are not sick and you want to protect yourself, that surgical mask, yung nakikita natin may puti at may blue, actually wouldn't help. And what's happening is that people who needs it are now buying it at an expensive price.
I need to cut you there. Why are you saying that the masks won't help if everybody is saying wear your masks and wash your hands every day?
It's actually wash your hands regularly, practice proper hygiene, avoid spitting in public, and cough on your elbow. So it does not say wear your mask. Because that's actually not effective for this kind of virus, the N coronavirus. It cannot filter this kind of virus. It's a surgical mask that is used in the operating room because if you're operating, the health workers wouldn't like their saliva while they're discussing the case to go onto the patient and contaminate the patient.
Yeah. Do you agree? Well, she's a former health secretary, but would you wear a mask, Congressman Ong?
I think I would.
Yeah.
If I have symptoms.
Because I hear it all the time. You have to wear masks, hindi ho ba? And then now you have the former health secretary saying it's actually not going to help. That confuses me more.
It wouldn't help you protect. I mean, I'm referring to the surgical mask. You have to have the N95 mask. It's not that easy to wear kasi mainit yun tsaka sarado yun. But that prevents you from the virus. But that is only recommended when you're in a highly endemic area or if you're a health worker, excuse me, dealing with the patient. Kung kunyari, naglalakad ka sa mall. Kung kunyari, because we are talking about a virus that is not airborne. This is not measles.
Droplets.
This is not tuberculosis. And ang naging problema, kasi palagi yan every time may sakit, sasabihin ng tao, ay direct contact, airborne yan. So the first thing that DOH goes, we always come out, me and 5 others are assigned as spokesperson, iba ang airborne, iba ang respiratory droplets. So our advice...
So okay, let's clarify that. Iba airborne, iba ang respiratory
iba ang
droplets.
direct contact with respiratory droplets. When you say airborne, pwede mo siyang...
Sa hangin.
Sa hangin. Pwede mong, in Ilonggo,
Nasa
pwede mong
kapaligiran.
mahaklo. When you say direct contact with respiratory droplets, let's say I cough on my hands. I hold
Hinawakan mo si Congressman.
Hinawakan ko si Kong. Tapos si Kong ngayon, hinawakan yung mata niya, yung mouth niya, nahawa siya ngayon. That's why the mask can somehow protect. Kasi kung may mask ka,
Yeah,
Pwede mo
tama
hindi
naman.
mahawakan.
That's right, because it actually prevents you from
Touching your face. However, if you're infected and you keep on touching your face, kunyari may mask ka, may nakuha ka, may nahawakan ka na secretions, you do this, you will still be infected because that's not an H90, that's not an N95 mask.
I see. Okay, so you have Secretary Duque saying, wear your mask, wash your hands all the time, and then you have a former secretary saying the mask actually will not help. I think, what can we do?
The surgical masks.
Yeah, yung surgical masks. Ang sinasabi ni Congresswoman ay kailangan N95.
95.
Kong, how about you? Does that cause more confusion right now for you?
Yes, it does.
Right?
Kasi like us, we're not doctors. So ano ba talaga dapat natin gawin? And I would also like to add, Pinky, we have a different situation now because you see a lot of Chinese going around the city because of the phenomenon of the pogo. So magkaiba to noon nangyari yung SARS. Ngayon you see them everywhere. Actually, there are even some restaurants in Macapagal Boulevard who only serve Chinese. So ibang-ibang sitwasyon. So syempre with all the fake news happening, hindi alam ng Pilipino ngayon kung ano ba talaga. So now, with the mask, may confusion din. Tapos, that's why I'm pushing for DOH to play a more active role.
Yeah.
And then, I mean, with agreement with Kong, na magkaroon ng command conference.
Ano pa? Yeah, command conference. What else, Congressman?
Magkaroon talaga ng dissemination yun sa social media. And magkaroon talaga ng tuloy-tuloy. Kasama na dapat ang DILG at saka Department of Education.
Yeah.
I was even talking to some Chinese last night galing from schools, from Chiang Kai-shek, Grace Christian, and I was asking them, bakit nga ba nagsara? Ano
Hindi
ba yung
naman
reason?
nagsara,
I mean,
nag-cancel
I'm
ng
sorry
classes,
for
yeah.
nag-cancel. Bakit ba? Ano ba yung reason? And the only reason they were giving me is, madami daw kasing Chinese national na nag-aaral na students. Kasi because of the Pogo phenomenon and others.
Yes.
Kaya ang dami daw nilang students na from China.
You know, in fact, there was, I don't know if we can put that up on the screen because I discussed this again last Monday. I think it was Uno High School, Congresswoman, Congressman. Interesting yung kanilang sinabi doon. So, suspend ng classes nung Monday, and then parang they were urging students and personnel who have come come
China.
from areas that have been infected with the virus to do a self-quarantine for 2 weeks. I think they took it even a notch further na, sige, kung galing kayo, wag muna kayong mag-self-quarantine muna kayo. Was that a good idea?
Yeah. Yes. Talking about maraming restaurants ng may Chinese, we have to be careful because we're treading on a very dangerous path kasi nagkakaroon tuloy ng discrimination.
Yeah.
Correct.
Yeah.
Okay. Parang this did not happen in Merskov.
No, but I'm sorry. He mentioned
Yes.
it. Congressman Ong already said, wala naman talagang pogo, hindi naman tayo.
Yes.
Yes, but my point is, sa Merskov, Middle East yon, sa Saudi yon, ang dami, no? Pero hindi nagkaroon ng, siyempre siguro baka because of social media ngayon, if we keep, we have to be worried.
Okay.
They are doing the Chinese government is doing their job. Kasi pag diniscriminate natin yung niche ng population na probably pinanggagalingan ng sakit, it will be
Okay.
more difficult to find a solution to the problem.
Yeah.
But that's right. But that's why we need more information.
Yes, I agree.
So yun yung mga steps, no? Yung command conference, social media, and siguro the
And
press
even the
conferences every day.
establishments, Pinky. Kasi like ako, papasok ako sa restaurant, nakita ko lahat ng mga waiters, parang, I'm a doctor, I'm aware, I get nervous. That's a human reaction.
Yeah.
So the DOH should come out and say what should be done, what should not be done. You cannot say, okay, wear your mask even if you know that kind of mask will not protect you from the virus. Kasi may mga butas yan eh.
Opo.
At hindi yan naka-close, hindi yan nakasarado.
Kahit na yung tinuro sa atin na pag sinuot mo yung mask dun sa solid area, igaganon mo dito sa ilong mo para
Yes.
kahit yun.
And what if
That doesn't-
and then the proper hindi meron ka sa side eh. And then the pores of that is different. Remember
Okay.
this virus are very
All right.
small. So yun naman, how do you properly use a mask? You dispose it every how many hours?
Do you ano?
4 hours, I think, right? Every 4
How
hours.
do you dispose? Can you tell us before we go on a break?
Yeah,
When
you
wear
change the surgical mask, you change it every 3 to 4 hours. Ngayon, tinapon, ikaw ngayon may sakit, tinapon mo lang dyan. or iniwan mo dyan,
Opo.
kinuha ng helper mo or
hinawakan.
assistant mo, then you spread the number of sources of infection.
Every
I mean,
4 hours, you need to change
But again, Pinky,
our
let me-
masks, but the surgical mask doesn't help, according to
If you are
Congresswoman
not
Garin.
in a if you are not in a
Okay.
hospital, and if you are not you are not in ground zero, you do not need to wear an N95 mask.
All right. Just a couple of measures that need to be implemented. I want to ask Congressman Ong and Congressman Garin about that. The visa upon arrival, that's been suspended. And there were cruise ships coming from Hong Kong and China that actually
Subic.
arrived yesterday, and they were on their way to Subic, but pinigilan po sila. We'll talk about that after the break. You're watching The Source. We're still talking about it, especially the mask. You know, this is important to most of us. Congresswoman Garin saying, kung ikaw ang may sakit, okay, may ubo ka, may sipon ka, yung puti ng mask dapat nandito sa loob. Kapag undergoing, mahina ka, yung immunity mo medyo mababa, yung puti ang dapat nasa labas. Correct, no,
Yes.
Congressman? All right.
But Pinky, let me categorically correct that the mask is useful for, kunyari, you're a diabetic patient, you're undergoing dialysis, or you're undergoing chemo. The mask will protect you from the other illnesses. Kaya nagmamask sila para
Mahina
yung
kasing
regular na
kanilang-
ubo, mahina yung resistensya eh. Ayaw mong magkaroon ng, let's say, tuberculosis, yung ordinary cough, ayaw mong mahawa ng ibang mga sakit. And
Kasi
ayaw mong
mahina ka.
ma-inhale
Okay, all
yung
right.
toxins na ba?
We need to talk about measures that need to be put in place. Okay, cruise ships. They're right.
Genting, yes.
Dumating kahapon at I think nung isang araw. Anyway, that was about 1,400. The other one from Hong Kong was supposed to make its way to Subic. Subic said, no, you're not going. So they're supposed to leave today.
They're back in Manila, I think.
Are cruise ships, do you think cruise ships should be prevented from wherever entering the country right
I don't
now?
think so.
Congressman? Hindi naman.
Yes.
Hindi
Not
naman.
even, okay,
No.
not even the origin, which is just China.
But I think ang may segment na kakalimutan natin is mga OFW natin.
Okay.
I think kailangan natin silang alalayan. Hindi ko alam kung what DFA is doing right now. Direct contact eh. Like we have around 300,000 in Hong Kong, and I think we have around 250,000 OFWs also in China. The embassy should be open for assistance. Kung meron man, may symptoms, so matulungan ka agad. I don't know kung meron na tayong ganung klaseng...
That was discussed yesterday lang
Yes,
po.
kailangan meron din.
Yeah.
You know what? That was what I was saying. And it's in place, but it has not been activated. Because when MERS-CoV struck, na panahon na medyo nanganganak yung mga camel, nagkakasipon yung mga baby camels, we activate it. Ibig sabihin, the DOH loops in the embassies concerned.
Yeah.
And then, linalabas yan sa Facebook, sa social media. O, kung ikaw ay taga Hong Kong, call this number. Kasi ang mga Pilipino sa mga ibang bansa, mas kulang yung healthcare nila.
Correct.
Let's say you're in China, you're in Hong Kong, or you're in Japan. Alam nga namang pumunta ka sa private hospital, it's expensive. And their government, syempre hindi mo naman sila masyado silang busy. Yung mga Pilipino dapat may natatawagan. And it's already in place. In fact, there were proposals to put a health envoy. I think the corresponding funds was not available. But moving forward...
What else should be done? Ano pa ho? Yung mga overseas Filipino workers,
overseas workers,
they
dapat
discussed
may
this
natatawagan,
yesterday.
yes. And then there should be clear-cut like, okay, etong cruise ship ba, pipigilan ba o hindi? Yung establishments
No, but
ba,
you're
like
saying
hotels?
no. Sabi niyo, cruise ships can still, come.
Consider.
Because it should not be a per-country decision.
Why? Because you're saying, is it discriminatory?
Not only that, it has huge social and economic impact. Okay, moving forward, nagdedebate kasi why is WHO not declaring the situation a public health emergency of international concern? Because when you do that, you do not only think about health, titingnan mo yung pangkabuuhan. Remember, they're not yet declaring because they are weighing things. Ano po bang impact sa kalusugan? Ano naman ang impact sa social and ekonomiya ng mga bansa? And they're looking at that. So the travel ban and the travel advisories are actually coming from them. So
Okay.
even WHO all the advisories, all the inputs does not come from their country or regional
Okay.
offices. It comes direct.
I just need to know, what else do you think we can do to prevent it from entering the country? Ano pa ho tingin ninyo kulang o pwedeng
There
gawin?
should be a more proactive monitoring and surveillance. Kasi simula nga last week
How?
and 2 weeks ago, okay, the health declaration checklist has been removed. They say it's back. But
Ito yung
I don't
yellow.
think, yes, it's, paano po ba, gaano ka-importante yun? Pagka na-check mo, i-check mo yun nagka-sip-on ka ba the last 2 weeks, lagnat, panghihina ng katawan, okay. Kung may naka-check dyan, you go to a room.
I understand that. Yeah,
where the
I'm sorry to cut
doctor-
you, we're running out of time. Here's the thing that I need to bring into this discussion. We can all lie about that. Why? Because I don't want to be isolated. How do you prevent that from
That's
happening?
true. You can lie about it. But how about those who do not lie? At least you get that niche of population that the doctor can examine. And what happens is that you're given a number. Let's say I had
Ito yung
cough.
ano mo.
O, kasi yung number na yon, you text that number every day. And you update them where
So
you
dapat
are.
ibalik yon kung hindi pa nababalik according. What about ano?
I don't know if it's
Congressman?
even possible. I think even the private airlines should be briefed. They should be taught na pag may symptoms, sabihin na.
From the FA,
Yes.
i-check na.
Even sa pag-check-in mo sa counter.
Mula dun pala.
Yes, from the source.
Kasi pagka nasa airplano ka, nagmamadali
Wala
ka
na,
na.
tsaka
check.
ang dami mo ng
no,
katabi.
no ka na lang para
You are correct.
Although our experience, yung mga nagkakasakit, yung mga
Okay.
natitingnan namin, they really filled up the yellow form.
Dapat, sana ganun. Question hour. Gusto niyo pa ituloy to kay Secretary Duque? Is it time? Ngayon ho ba dapat gawin yan?
I would have opted, for me personally, I would have opted for like a briefing, let's say from the WHO and the DOH with the government officials. Kasi,
So wait, question hour. Do you still want that with Secretary Duque?
well, it
Please
has been
answer.
decided, I believe, because there
think
was
yes.
already a motion,
Motion.
so it will continue.
Okay,
Continue.
magtutuloy yan. Mabilis lang. Congresswoman, yung pag-disinfect ba sa mga aeroplano, does that kill the virus? I
Somehow,
saw in-
yes.
it
Yes and
does.
no.
It
No,
could.
it depends on the virus. Yes
Yeah,
and no.
okay.
But come to think about it, may pasyente nagpo-positibo sa this kind of viruses, coronavirus, MERS-CoV. Pagbaba ng eroplano dito, nagne-negatibo na sila. We don't know. It can be the pressure, it can be the load. Okay.
All right, we've run out of time. I wish we had more time, but I'd like to thank both our guests, Iloilo Representative Janette Garin and ang Probinsyano Partylist Representative Ronnie Ong. Thank you both, and we'll see you again. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.